connect then video. Okay.
Hey, good afternoon, everyone. So, as you can see, we are enough participants here, and we are almost nearing to 2 o'clock. I guess we will start the session. By the time we'll be done with the introduction, it will be 2 o'clock, and then we can straight away start with the session. I guess this should be okay. So, hello everyone, very warm welcome to today's continued Ayurvedic education session sponsored by Ayurveda Central, co-powered by Ayurveda One. I'm Dr. Usha, your host for this session. On behalf of Ayurveda Central and Ayurveda One, I'm really happy to have you all with us today. Our mission through this session is simple: to share authentic Ayurvedic wisdom and bring together doctors and practitioners who are passionate about learning, sharing, and growing together. Today's topic is Beyond Necrosis, Ayurvedic Healing in AVN Femur. It's going to be an insightful session where our speaker will build Ayurvedic and modern understanding of AVN. And more interestingly, he will also walk us through the successful clinical studies, showing how Ayurveda can make a real difference in managing this complex situation. So you can look forward to learning about practical treatments approaches, key formulations, and holistic management strategies that have yielded promising results in real patients. Before we begin, I would like to take a moment to introduce our brands. Ayurveda Central, as many of you know, is proud to be pioneer in organized Ayurvedic healthcare. From the first clinic in Arjinagar, Bengaluru, we have now grown to 60 clinics across Karnataka, supported by over 120 experienced doctors. Today, Ayurveda Central stands as India's largest Ayurvedic clinical chain, reaching patients across the country through both our clinics and our strong online presence. Our sister concern, Ayurveda One, is an Ayurvedic medicine manufacturer that focuses on creating doctor-formulated, result-oriented products, combining classical wisdom with modern quality standards. At Ayurveda One, our goal is to deliver medicines that truly make a difference in people's health and well-being. Through this platform, we aim to spread our wings across India and bring the benefits of Ayurveda to people everywhere. A few quick notes before we get started. You will this moment. You will find the link to our channel in chat box. Do join us to stay updated on our upcoming webinars. Please make sure you have entered your correct email ID during registration to receive your participation certificate without bounds. The session will last about 1 hour. Type your questions in the chat box anytime. We'll take them up during question and answer session at the end of the session. And lastly, do not forget to enter your full name and email ID in the chat box to receive your participation certificate. It gives me great pleasure to introduce today's distinguished speaker, Dr. Sachin TIke, Assistant Professor and in charge HOD of Panchakarma at Government Ayurvedic College, Osmanabad, Maharashtra. Dr. Sachin completed his BA/MS from N.K. Jagshetty Ayurvedic Medical College, Bidar in 2001 and his MD in Panchakarma in Government Ayurvedic Medical College, Bangalore in the year 2008. Over the past 16 years, he has been shaping minds and touching lives as an assistant professor in leading Ayurvedic medical college across Kerala, Nashik, Nanded, and now Hoswara. Dr. Sachin has Dr. Sachin has worked with Kottakkal Ayurveda in Bangalore, conducted Panchakarma training programs for NRHM medical officers Maharashtra, and served as a resource person in numerous seminars and CMEs. Dr. Sachin has presented 6 research papers at national and international Ayurveda conferences and published around 11 papers in reputed Ayurvedic journals, along with several articles in newspapers and talks on All India Radio. He has also participated in 6 ROTP programs and more than 40 seminars and workshops across India. Beyond his academic accomplishments, Dr. Sachin TIke is deeply passionate about teaching, research, yoga, acupressure and promotion of Ayurveda and Panchakarma. His commitment to spreading Ayurveda is evident through the free health camps he regularly conducts to serve the community. Today, he will share his insights on Beyond Necrosis, Ayurvedic Healing in AVN Femur, along with few of his clinical success stories, showcasing how classical Ayurveda continues to offer hope and healing in challenging conditions. Please join me in extending a warm welcome to Dr. Sachin TIke. Dr. Sachin TIke, the session is all yours.
Thank you, ma'am. Guru Brahma, Guru Vishnu, Guru Devo Maheshwara, Guru Sakshat Parabrahma, Tasmai Sri Guruve Namaha. I pray the Lord Dhanvantari and all my Gurus, with their guidance, I am here to share my AVN journey. I am not here to tell or to claim tall claims, but I am here to share my AVN journey. First of all, I will like to share. Hello.
Hello, yeah, please. Yeah, please go ahead.
Am I visible?
Yeah, slide is visible.
Okay. So, first of all, I would like to thank Ayur Central and Ayurved One and Dr. Usha for providing me this wonderful platform to share my experience on AVN journey through Ayurveda. So, Beyond Necrosis, Ayurvedic Healing in Avascular Necrosis of Femur. So, I want to clear that with respected all audiences, my teachers, my colleagues, my juniors, respected practitioners and students, that I'm not here to claim any tall claims, but I'm here to share my AVN Ayurvedic journey. And I'm really eager to listen your feedbacks and your own experiences about the same AVN of femur. So it should be give and take seminar, what I supposed to tell you. So avascular necrosis of the femur head is a challenging condition which is characterized by the loss of blood supply to the bone, leading to tissue death, pain, stiffness and impaired mobility. So conventional treatments often focus on surgical interventions with variable outcomes. Ayurveda offers a complementary and holistic approach by addressing the root causes through detoxification, that is Panchakarma, Shamana, and all other holistic integrated approach like acupressure, acupuncture, Agni Karma, physiotherapy, and of course sometimes conventional treatment also.
Sorry to interrupt you, doctor. Could you please try sliding your PPTs, because the slide shown here and the content is not in congruence. So could you please try to slide your
it's Beyond Necrosis, the two bone figure is there in on slides.
Okay, yeah, the same thing. Okay.
I'm on the same slide.
Okay, doctor.
Okay. So today we explore this holistic Ayurvedic approach and their relevance to managing avascular necrosis to provide hope beyond the conventional care. This approach not only targets the symptomatic relief but also promotes the tissue healing and disease management through time-tested Panchakarma therapies and balancing all the doshic equilibrium. So today's what are the key objectives and takeaways for this webinar is to explain about the pathophysiology and conventional challenges about the avascular necrosis of the femur. Then to introduce the Ayurvedic treatment modality, Panchakarma and Shamana Chikitsa, and to provide alternatives to conventional AVN treatment. Because in conventional avascular necrosis of femur treatment, there is a surgical option is there, and which is not so safe and having its own variable outcomes. And another one is to explain specific Ayurvedic approaches, including Panchakarma and Shamana, and managing symptoms and promoting health. And to highlight holistic lifestyle and pathya that support Ayurvedic healing in avascular necrosis of femur neck. And to encourage the integrative thinking, integrative approach about combining the conventional medicine with Ayurveda, physiotherapy, acupressure, acupuncture, and all other procedures for better patient outcomes. So with this holistic approach, we will move towards the presentation. So today's presentation will be first few cases. I will share the few cases success stories. Few case presentation means the details about the cases and their symptoms. Then Ayurvedic point of view about the avascular necrosis of the femur, and then modern point of view about AVN. Then Shamana Chikitsa, Shodhana Chikitsa, and then observation and results discussion, and then we will come to the conclusion. So with this pattern today I am going to present to my webinar. So coming towards case presentation. So these are the cases which came to OPD of Department of Panchakarma, Government Ayurvedic College and Hospital, Dharashiv, Usmanabad. So moving towards case 1. So 43 years, male, admitted on 29 Jan and discharged on 1 June with these all other OPD and IPD details. And along with that, MRI both hips, which is having stage 2nd and 3rd on right and stage 2nd on left hip, left femur, avascular necrosis, and all the patients having same or one or the other same complaints like Ubhaypad Shul, Chankraman Kastata, Vankshana Sandhi Shul means unable to walk or difficulty in walking, hip joint pain, difficulty in sitting since 1 year. Because this patient will not come in early stage, in first stage. They will directly land up in 2nd or 3rd, then they will realize. And other thing is that many of patients will think that that is a compressive neuropathy or some lumbar problem is there, and they get treatment from conventional physicians or Ayurvedic physicians also for Katigata Vata, for compressive neuropathy. And then when they land up and when they get investigated and they came to know about the AVN, and that time they would have been landed in 2nd or 3rd stage. So before a 1 year patient had all these complaints and past history, epilepsy, so having treatment Gardinal, and the interesting thing is that he was COVID positive and taken COVID vaccination. Then moving towards case 2nd, age 45, female. These are the hospital details and having the same complaints, Vamkati Shula, Janusandhi Shula, Dakshina Janusandhi Shula, Chankraman Kastata, Nashnata Kastata. Here we can see the different complaint. She was having compressive neuropathy also. So low back ache was also there, and she was having left femoral head AVN grade 3rd and left hip joint effusion also. And she was known case of rheumatoid arthritis also. And interestingly, she was also COVID positive, taken COVID vaccination, and menopause 6 years ago. So Asthi Kshaya Jana Samprapti was also there. And then moving towards case third, 34 years male, complaints having hip joint pain, leg pain, hip, unable or difficulty or unable to walk or sit down, and AVN bilaterally grade third. So you can see the duration is of 2 years and they landed into grade 3. So if patient will come in early stage, it will be easy to treat the AVN. Then they also taken steroids, painkillers, and interestingly he was found to be hyperlipidemic. COVID vaccination has been taken. So COVID and hyperlipidemia was the different thing. Then case 4, 44 years male with Uru Shula Chankraman Kashtata. You can see the duration since 1 year or 2 years, and AVN right grade 2nd and left grade 3rd. And he was also COVID positive and had taken remdesivir and steroids and COVID vaccination also, and taken ecosprin tablet also. And these complaints are gradually developed, and so that's the reason all other complaints mask as a Katigat Vata, and the patient will get treatment of Katigat Vata, and when it get diagnosis, then it will end up in grade 2 or 3. Then moving towards case 5. So male patient 43 years and having Padashula, Asnotta Kashtata, Chankramana Kashtata, Pada Ankunchan Prasaran Kashtata with SLRT positive, means having lumbar compression neuropathy also, and bilateral grade 3 AVN. So since 8 to 9 months, means again around 1 year that complaints are there, and COVID vaccination 2 doses has been taken. So COVID relation was there. We will go through detail in that in future also, in future slides also. Then coming towards case number 6, age 33, male, having leg pain, hip joint pain, and difficulty in walking and sitting, and with SLRT positive, means having compressive neuropathy, lumbar compressive neuropathy, low backache also, and bilaterally even right grade 2 and left grade 3. So this patient also received COVID vaccination dose also, 2 doses has been taken, and he came within just 3 months but landed up into grade 3. So this is the information or symptoms and reports about the cases. Now we will see the summary. So common presenting complaints were what? Padashula, Vangshan Sandhi Shula, Chankramana Kashtata, Asanotthana Kashtata, leg pain, hip joint pain, difficulty in walking and sitting. These were the common presenting complaints of all the 6 patients. SLRT test was positive in 2 patients out of 6 patients. COVID positive patients are 3 patients out of 6. Then COVID vaccination 6 out of 6. So all the patients have received the COVID vaccination. Then MRI findings. Out of 6 patients, 5 patients having bilateral AVN, and out of 6 patients, 6 patients having grade 2nd or more than grade 2nd, and hyperlipidemia. Out of 6 patients, 5 patients found to be hyperlipidemic, and out of 10, 4 dropouts were there. So I am presenting the data of 6 patients. So previously, when it was rare that AVN patient will visit Ayurvedic hospital, and that time I was also referring them that there is no alternative, you have to go for the surgery. And but when the flow was, it started increasing after COVID and after COVID vaccination and after taking steroids and remdesivir, then I started thinking what can be done or what we can do as per our Ayurvedic principles, and then I started giving treatments, and then patients flow again started. So before that, few patients came and went for surgery also. So at least 30 plus patients have visited about AVN, but this is a long duration treatment. We will discuss in other slides also. So the patients who have the mentality to stay for longer in as a IPD, they only stay and which believed on Ayurveda and which patients don't want to go for the operative, they only carried the treatment plan. So now we will move towards the Ayurvedic point of view of avascular necrosis of femur neck, because avascular necrosis can happen at any bone. So we are dealing with femur neck, but these principles can be applied to others also. So in Ayurveda, there is no direct disease name as avascular necrosis or nearby that, but we can think like it's a like syndrome. How we can say the 2 or 3 diseases and we call it as a syndrome. So it's like a syndrome. And in Ayurveda, one term is coined as anuktavad, and Acharya says that every disease need not to be named or can't be named. So for that type, what Acharya has mentioned that we have to see the vikar prakriti, nature of disease, adhishtanantar, that is site or location or system, organ, tissue, cell of that particular disease, and samutthana vishesh, hetu, etiology, cause of disease we have to see, and depending upon that, dosha samurchana, samprapti, and we have to do the samprapti vigatanameva chikitsa. So it is not like that if it is not mentioned in our Shastra, then we are not supposed to give treatment, but depending upon all these factors, we can plan our treatment. Then here it's a disease of bone. So what is the main function of Asthi is dharan, deha dharan, and what are the moola? Medo and jagana. So jagana is a pelvic bones and meda. So these are the moola sthana, so which will help us in our treatment. Then what are the astiva srotas dusti hetu? Ati vyayama, ati vigattanat. So excessive injury, trauma, vyayama, vata prakopa. Then what are the samanya srotas dusti lakshana? Sangha and vimargaman. So here we can see sangha or siranam avrodha. Both these lakshana will be there in this disease. And what are the astiva srotas dusti lakshana? So asthi bheda shula. So here it is a cutting like pain, severe pain is there, while minor movement also of hip joint, the patient will feel tremendous pain. How we can correlate or what the diseases or what under the umbrella of this AVN we can consider or correlate in Ayurveda. One of this is Asthi Dhatu Kshaya. If we can see the symptoms which correlate with AVN of femur, is Sandhi Shaithilyameva. Then Shiryanti means severe pain, Sandhi Shaithilya, that is dislocation, Durbalani, that is destruction, Laghuni, that is osteoporosis, and Vata Rogi, Vata Prokop, that is Asthi Dhatu Kshaya. Then moving towards Asthi Dhatu Kshaya, Bhedo Ati Parvanam, Sandhi Shula, Mausabala Kshaya. So their pain is there, Sandhi Shula is there, Mausabala ligament which are covering or which are supporting the hip joints, they are also get degenerated. Then why we are considering here Ubhayasrita Vatrakta? Because Khanja, Pangu, these are the complications of Vatrakta, and in this also Vata is also involved and Rakta is also involved, because there is a improper circulation, blood circulation through the hip joint, and Vata and Rakta both are involved. So we are considering it Ubhayasrita Vatrakta. So we are thinking Asthi Dhatu Kshaya, Asthi Dhatu Vata, and Ubhayasrita Vatrakta, and depending upon that we are planning for the treatment of AVN of femur. So what are the samprapti ghataka? Dosha are Vata Pradhanatra dosha, Dushar, Dhatu Asthi, Rakta, Med, Majja. Then Upadhatu are Sira, Kandara, Snayu, these are the ligaments. Then Sthan, Udbhav Sthan is Astiva Srutas. And Sanchara Sthan is Vankshana Sandhi, hip joint, and Vyakta Sthan is Urvasti, that is femur. So these are the samprapti ghatakas are there. And then what is the Srotas Dushti? Sangha and Vimargagaman. So what is Sangha? So here vessels get globules, fat globules deposition, or cholesterol or lipid deposition, and due to that the improper supply, of the blood to the femur, that is Sangha. And what is Vimargamana? Fat globules or any other obstruction that is coming in the vessels, that is Vimargamana. Rogamarga is Madhyama. Swabhav, it's a chronic, and Sadhya Sadhyata is Kashta Sadhya to Asadhya. If patient comes in first or second, then it is Sadhya. In third, it's Sadhya, and fourth, it's Asadhya. Am I audible, Dr. Usha? Hello?
Yes, you are, doctor.
Yes. Then moving towards Samprapti, Hetu Sevana. Due to Vegavrodha and Vatakara Ahar Vihara, Aghata, today's Harivarikari lifestyle, it leads to Agnimandya, then Trikasandhi Pradeshi Ama Sanchaya, and then due to Srotorodha and Dhatu Agnimandya, Prakrita Vata Vahana Avrodha, Prakrita Rakta Vahana Avrodha, Vata Dosha Prakopa, Rakta Dosha Prakopa. Then Vayu Vivradhe Vradhena Raktena Avratipati. So this vitiated Vata obstructs the Rakta, and Vangshan Pradeshi Rasa Rakta Abhisarana Avrodha obstruction to the normal flow to the hip joint. Then due to this, it leads to Dhatu Kshaya, Asthi Kshaya, Asthi Majja Kshaya, and leads to avascular necrosis. So this is the pathophysiology according to our science. So then, what are the Samanya Chikitsa Sutra? All we know that in Asthi Dhatu Tikta Kshira Sarpi Basti has been mentioned because Asthi and Vata Rasrasri Sambandha. So Tikta Kshira Basti is there. Then or Tikta Grata, Tikta Kshira Sarpi orally or Basti. Then in Asthi Majjagata Vata, Bahya Abhyantara Sneha. So share Bruhana, Bahya Abhyantar, either internal or external, Pana, Abhyanga, Basti. That Bahya Abhyantar Sneha has been mentioned. And in Vata Rakta, Virechana, Sneha Virechana, then Basti Karma, Seka, Abhyanga. So again Virechana and Basti, and again Snehan, Abhyanga. That is in main part of our Chikitsa. So this is all about Ayurvedic pathophysiology and line of treatment. Now we will move towards the modern point of view of avascular necrosis. So this is the anatomy of the hip joint. Acetabulum cavity, it's a Udukala Sandhi, ball and socket joint, and head of the femur and acetabulum of the pelvis. These are the two involvement. Then hip joint it's a strong with ligament and musculature, providing a relatively stable joint. It is having ligaments and joint capsule also. Main ligament is iliofemoral ligament, then pubofemoral ligament, ichiofemoral ligament, and ligamentum teres. Why these ligaments are necessary? To hold the joint in proper, because it's a weight bearing joint, and maximum movements are also in there. So blood supply, this is the main culprit. Due to lack of blood supply, this disease occurs. So it's supplied by obturator artery to medial and lateral circumflex femoral arteries, retinocular arteries, and the acetabular branches of obturator and medial circumflex femoral arteries. See, we can see the number of arteries having supply to that, but still it will hamper the blood flow and the disease occurs. Then moving towards nerve supply, so femoral nerve is the main supply to this hip joint. Then what is avascular necrosis as per modern? It's a cellular death of bone components due to disruption of the subchondral blood supply. It results in pain, loss of joint function, and long-term joint damage. It is also known as osteonecrosis, septic necrosis, and ischemic bone necrosis due to lack of blood supply or improper blood supply. What are the hetus or causes? Traumatic fracture or dislocation, or traumatic or alcohol, excessive alcohol, corticosteroids, which were abundantly used in COVID or post-COVID complications, then sickle cell disease, Gaucher's disease, autoimmune disorders, like RA also. Then what are the risk factors for avascular necrosis? Age, third or fifth decade, it will be more common. Then due to alcohol, it preserves the blood flow and causes necrosis of the bone. Then genetic factors, sickle cell or Gaucher's disease. Then obesity. It puts additional stress and it may increase the fracture and risk of avascular necrosis. Then thyroid disorders. It influences bone metabolism density, bone reabsorption, vascularization, inflammation, and osteoclast and osteoblast balance. So this is I will try to present the modern pathophysiology. So due to trauma, so vascular interruption is there, and due to this COVID and all other coagulopathies, intravascular coagulation, thrombotic occlusion occurs, which decreases the blood flow, which causes ischemia, and other side alcohol, corticosteroids, and fat embolism or fat emboli. They causes extravascular compression to the vessels, and all this leads to ischemia, and which causes osteocyte necrosis, and it hampers the repair also, and loss of structural integrity, and leads to the head collapse. So this is the modern pathophysiology of avascular necrosis of femur neck, avascular necrosis of femur head. Then symptoms of avascular necrosis, so joint pain, limited range of motions, stiffness, swelling, limping and disability, whatever the complaints we have seen about all these 6 cases. So stages of AVN. First one is asymptomatic, only identified by MRI, we can't identify it by radiographically X-rays. Then in second stage, radiographic changes, sclerosis, osteopenia, subchondral cysts are there. In third, joint space narrowing, round counter compromised, crescent sign comes, and in fourth, collapse of the subchondral bone occurs. So we'll see the classification of the
classification is a commonly used system to stage osteonecrosis of the head. There are 4 stages. Stage 1, the X-ray is normal. The MRI has an abnormal signal, changes in the marrow. Bone scan will show increased uptake. Stage 2, the X-ray will show mixed osteopenia and or sclerosis. There might be subcondylar cyst and lucencies. There is no crescent sign, no subcondylar fracture, and no collapse. The MRI and bone scan will be abnormal. Stage 3. The X-ray will show crescent sign, which is a subcondylar fracture line and may be associated with collapse of the femoral head. MRI will show the changes that are seen in the X-rays. Stage 4, the X-ray will show collapse of the subcondylar bone and severe deformity of the head with secondary degenerative changes affecting both sides of the joint.
So what about the diagnosis of AVN? So first one is physical examination, the limping gait and pain, and hip joint restricted movements, and then X-rays, imaging tests are X-rays, MRIs, and CT scans. Then bone biopsies may be performed to diagnosis, but the main diagnosis depends upon the MRI scan. What are the treatment options in conventional science is pharmacotherapy, that is NSAIDs, and then physical therapy, that is physiotherapy, then surgical interventions, and lifestyle changes, adopting the lifestyle, including maintaining a healthy weight and avoiding all other apatyas. So main is a surgical intervention, and it may have the variable outcomes. And other thing is biological therapy. Mesenchymal stromal cells, they are injected, or bone marrow aspartate concentrate injected in the hip joint or particularly to that head of the femur. Then stromal vascular fraction, then adult autologous live cultured osteoblasts. They are cultured in the lab and then they are injected. 50% of patient experience progression to the clinical failure, and in some 50% cases they get good results also. So both BMAC and ALCOs are based on the principle that osteoprogenitor cells in bone marrow facilitate and induce new bone formation. So it's like bone marrow therapy only. Then vascularized bone grafting technique. Now in this, transplanting a piece of healthy bone with its blood vessels from one area of the body to the necrotic bone site, and we have to watch for the progression of the bone growth. In surgical interventions, there are n number of options are there. Core decompression, bone grafting, hemiarthroplasty means one joint is only replaced. A total joint replacement means acetabulum cavity as well as head is also both replaced. But it's having their own limitations, and also cost is the main matter for the patients. So what is the prognosis and recovery? The prognosis for avascular necrosis can widely vary depending on the underlying causes like stage of condition and effectiveness of the treatment and chronicity of the disease. Early diagnosis and appropriate management can significantly improve the outcome, whereas the long-term prognosis may be less favorable. Recovery process from AVN can be a lengthy one, often taking several months to years depending upon the severity of the condition and type of treatment and how the patient responds psychosomatically. So this is all about modern pathophysiology, symptoms, treatment and diagnostic. Now we will move towards the Ayurvedic treatment, Shamana Chikitsa, that is oral medications. So this was the general protocol what we developed when treating such kind of AVN cases. So Shaman Chikitsa, then Shodhana Chikitsa, in Shaman Dipan Pachan is also there, then Shodhana Chikitsa, in that vitiation, and different types of bastis like Manchastadi Kshaya Basti, Yapan Basti, Panchakarma Kshira Basti, Jaloka, Charana, acupressure, acupuncture, Sthanik Bastis, Dharas, then Patya Patya, acupressure, and QRT, DRT, deep relaxation techniques, deep Shavasana, because all these patients were landed up in the depression because it's a chronic, long-standing disease, and in conventional science there is no any other option than surgery. So, mode of action of oral medications, how this Shaman Chikitsa works. So, I have prepared this presentation in view of the students, but for the practitioners they all know, so I will not go in content. So it will be time consuming. So I will just tell the kalpa and how it acts. So Ampachakvati, that's for the Dipan Pachan purpose. Then Gokshuradi Gugulu, it's for anti-inflammatory analgesic. It's a mutral diuretic property. Used in Vatrakta also. Then Panchatikta Grata Gugulu, it increases the bone mineral density. Then post-menopausal osteoporosis. Then Rasna Saptaka Kshaya, Shrotahara, Shulahara, Dhatu Gatavastha, capsular anti-inflammatory, which strengthens the muscles, tendons and manage the ama. Then Ashwagandha, Chopchini and Arjuna. Chopchini is a Rakta Prasadana. Arjuna, it carries the Sukshma Suratas. Arjuna is used because of Rakta Sangrahana, Sandhaniya, it's a Asthi Sandhaniya, Shonita Sthapana, and Ashwagandha is as Rasayana. So, this was given as a Kshirapaka. Then Yogendra Rasa, Gulvela or Guruchi Sattva or Ashwagandha Churna and Bala Churna combination. Yogendra Rasa is a neuromuscular condition, it helps to alleviate that. Then Guruchi is Jwarahara and Ashwagandha and Bala Rasayana Balya. And then moving towards Chandrapabhavati. These are the medicines what we have used in that AVN patients. And they also vary depending upon Prakriti and condition of the dosha samorchana also. It have mutral and helps to reduce the shortha. Then Jatamansi font. So I told that maximum patients are in stress, tension, depressive mood, or depressive condition. So for that, anidra, we use Jatamansi. Then Astolif Neutra, it's a herbomineral drug, which is nerve tonic, rasayana. It's having modern conventional medicines as well as Ayurvedic medications also. Glucosamine hydrochloride, which helps to maintain the health of cartilage. Then chondrin, which offers building blocks for the formation of the joints. So it's a herbomineral, conventional plus Ayurvedic combination of medicine. Then capsule palsineuron, which improves the muscle strength and mobility in individuals. And then Shivabutika, which used as a rasayana. Then Gandha which promotes healing and restores the musculoskeletal strength. And Asthi Vradikara, Asthi Majja Pachakavati, which is used in Asthi Shula, Sandhi Shula, and Asthi Majja Dhatu Agni. Asthi Majja Dhatu Pachan. Then tablet equation, because what I told that it's a holistic or integrated approach. So it acts as blood thinner and helps to prevent the formation of blood clots in the blood vessels supplying towards the hip joint. Then tablet Avana, few patients found to be accidentally hypertensive, and for that and hyperlipidemic also. To counteract that, we have used this tablet Avana. Then tablet Cardinal. Out of 6 patients, 1 patient found to be epileptic, and so we continue with that. Then capsule Lumbagist, as I told, 2 or 3 patients are having low backache with compressive neuropathy, and for that sake we have used this Lumbagist capsule. Then summary of oral medication. So I will not go in detail, so it will be a time consuming again, but such type of record we have to maintain. This is just I want to show how to maintain the record. What are the starting dates, how many days you have given that particular medication to the particular case. So it will give the value of our treatment in the in front of the conventional medicine doctors, and this will be the proper data will be there for our evidence based Ayurvedic medicine. So we can see that 98 days also means more than 3 months also few patients are there in IPD, and depending upon the avastha and dosha, samurchana, samprapti vigatan mev chikitsa, we have utilized the different medicines in different durations. Nagarjuna apparatus also we have used. Then Anulomana Gandharavati Churna. These medicines are already, and Lakshani Google is different one here. Then in case 2, one more or less same medications are then Neuro XT or Majja Tantuvati or Palxineuron. The combination is the same, only the brands are different. Amrutari Google we have used because some patients are having RA positive also. So in case 4, whatever the medicines we discussed, the same medications. Then in case 5, these are the duration wise treatment. Then case 6, Saraswatarishta, as I told that Anidra and Alpasatwa and depression. So there is definitely a Patya role is there. We have to avoid the Vata Vardikara Ahara Vihara, and we have to look after the Agni of the patient. So Patya, Madhurasa Pradhana, Shari, Dugdha, Takra, Grita, Vatagna Tail, exercise, physiotherapy, sun exposure should be there. And we have to avoid the Vatakara Ahara Vihara, and in Vihara Ati Vyayama, Ati Sahasa, Divasaka, like that we have to guide the patient, Dincharya, proper Dincharya and Rutucharya and Ratricharya, so that our disease will get benefit avoiding this apatya. So now we will move towards the Shodhana Chikitsa, Panchakarma Chikitsa in AVN. So what was the general line of treatment? So in Shodhana, Snehana, Abhyantara Snehana before Virechana, and Bahya Snehana like Abhyanga, then Svedana, normal Nadi Sveda or Sarvanga, Bashpa Sveda, or in few cases Shastikashali Pinda Sveda also we have utilized. Then Virechana, then Manjasthadik Sharavasti for Shodhana purpose. To remove the Sroto Avrodha in the vessels, and then Panchakarma Takshira Basti as a Balya Bruhana, Mustadi Rajapan Balya Bruhana Rasayana, and Mahasneha Basti, and few cases Majja Basti also. But Mahasneha Gata Telavasa Majja combination comes ready-made in the market, so instead of using Majja Basti, we utilize the Mahasneha Basti. Then in localized karma, Suchi Veda, that is acupuncture with just 26 number needle, which is easily available in the market with 2 or 3 rupees. Then Agni Karma, then acupressure, then Jalo Kaucharna, Dhanyamla Dhara, the Rukshana Chikissa, and then cupping therapy, dry cupping, and in few cases wet cupping also. So this was a general line of treatment what we have utilized in our IPD patients in Government Ayurvedic College and Hospital, Dharashu, Osmanabad. So in Panchakarma procedures, Snehana, Svedana, Basti, Suchivedana, the particular points regarding nearby the hip joint. So Snehana. So again, this is the data what we have mentioned properly, the with duration. So as we know that it's a Bruhan. Why we have used here Snehana? To as a Balya, Bruhana, and to improve the local circulation there, to elevate the Vata and to decrease the pain. And Murivenna tail is used for Sthanik Snehana, Thanik Dhara, Pichu, Bala tail, Vishagarbha tail. If Amavastha is there, Shota is there, Vishagarbha tail is used. Otherwise, Bala tail or Murivenna tail or Balaguruchadi tail has been utilized. Then Svedana, which reduces the pain, which reduces the avrodha, breaking the lipid molecules and thus clearing the vascular passage. We have used Nadi Sveda, Sarvanga Bashpa Sveda, Valuka Puttali Sveda, and as a Brahana, Shastikashali Pinda Sveda. These are the durations and days. Then Dhanyamula Dhara as a Rukshana Chikissa. Because Vagbhat has mentioned Brahmayetu Alpalangayat. So before going to do Brahmana Chikissa, we have to give the Rukshana Chikissa. And that elevated the pain also and Shot also. Then Virechana. So again it's Vatanuloman, Srotoshodhana, and which clears the obstruction of vessels and which helps the proper blood supply to the bone tissue in the femur head. What we have utilized as Abhyadi Modaka, Trifala Koat, Arabada Phalamajja Panta, and Manuka Panta, depending upon the coast Agni, we have decided that was Madhyama Shuddhi was our target, Madhyam Shuddhi to Pravar Shuddhi was our target, depending upon the patient's burden. Then we utilize the Panchatikta Vrata as a Snehapana before Virechana. These are the details. Then Manjistatic Sharavasti. In AVN, blood supply is compromised, leading to AVN. So Manjistatic Sharavasti, it's a Rakta Shodhaka and a Rakta Prasadaka, which promotes the blood supply to necrose part and enhance the circulation. These are the contents: Manjistha 20 gram, Guduchi 20 gram, then Estimadu 20 gram, and Kalka, Pshata, Pushpa, Estimadu, and Gomutra. And Anvasan Tail, Bala Guducha, the again Guduchi is there, Rakta Prasadaka. And Gomutra, if Gomutra is there, we have diluted it, and if fresh Gomutra is there, we have utilized directly in the Basti. Then after Shodhana Basti, after Manjistadik Shara Basti, then comes to the Bruhana Chikissa, Bruhana Basti, Panchatikta Kshira Basti. As we know, all the Tikta Dravas are utilized here with Kshira and Grata, Nimba Patola, Vagari, Guduchi, Vasa, and then Panchatikta Grata, Kshira, 250 ml Basti has been given. In few cases 8 days, in few cases 15 days, in few cases the cycle of Yoga Basti continued every month for the 3 to 4 months. Then Mustadi Yapan Basti is a Rasayana which hampers or breaks the disease progression. Yapya, it does the Yapya root disease. Then contains, as we know, Mustadi, then Kshira, Grata and Mounts Rasa. We have utilized as a Rasayana Chikitsa. Then moving towards Mahasneha Basti, as I told previously, we were utilizing or we are using Majja Basti, but we are the patient or their relatives has to bring all this Majja and bones, leg bones of the goat. It was somewhat difficult to prepare that. So we got Mahasneha in market. So it's a combination of Grata, Taila, Vasa, Majja. So then we started utilizing the Mahasneha Matra Basti, 60 ml. Mahasneha plus Panchatikta Grata, 30 ml, like that we have started using. These are the dates and duration. Then Suchiveda. It stimulates prana in marma. Suchiveda, we are not using the Chinese or all deep and hollow porous needles. With the 26 number needle, what we get in medical easily or government setup, which stimulates the prana in marma. It releases the endorphins and neurotransmitters in the brain, and it also improves the microcirculation to the affected area. It stimulates the blood circulation and it removes Vata. It alleviates the pain. Even situate points, so what we have seen in previous picture. And nearby nerve is femoral nerve stimulation purpose. Like this, these are the cross L type situate points in AVN near the hip joint. Then Agni Karma. Then it relieves the pain and it also stimulates the blood circulation and increases the growth of bone also. And the same situate points, you can see that 1 or 2 settings we have done to the patients. Then moving towards the Jalokacharan. AVN is due to the blockages in capillary arteries and Jaloka, which is having uridine, which acts as anticoagulant, which promotes the oxygenated blood to the affecting joint, and that's the reason we have utilized Jaloka. Max 3 to 4 settings we have done. One every setting after 7 days. Functions and depredation nearby the hip joint. Then cupping therapy. It may produce the analgesic effect via the nerves. It gives mechanical stimulation. And we have done the dry cupping only. And in few cases, because in some cases it alleviated the pain, so we have utilized in few cases only. Then acupressure, which causes stimulation to marma like Nitamba, Janu, Indrabasti, Katikataruna, Gulpamarma, and these marmas are responsible for the normal activities of body. And stimulation to these marma reactivates the body's natural healing response. So all this marma lies near the tibial branch of sciatic nerves, and stimulation to this causes relaxation and releasing pain. These are the points for the hip joints, near wrist joint, buttocks, behind the knee joint, at pinna, near the eyebrows, and all other. These are the sciatica points. So we utilize the hip joint and sciatica points for the acupressure in AVN. So as I told you, it's a holistic approach, and the main motto is to get the relief in the complaints of the patients. Then yoga procedures, Sandhi Sanchalana, Sukshma Vyayama, Dirghashasana, Kumbhaka, Uddiyana Bandha, Moola Bandha, Mahamudra, Brahmari Pranayam, Omkar Jap. Whatever the degree the patient can do these asanas, we try to guide them and try to follow the yoga procedures. Then relaxation techniques, Shavasana and Yoga Nidra. As I told, this is a chronic long-standing disease. All patients are not affordable for surgery. The fear of or phobia of the surgery will be there, or cost effectiveness is also there. So they are nearby or landed in depressive mode only. So these techniques plays a supportive role in management of avascular necrosis by reducing stress, anxiety, relaxing muscles, and improving blood circulation. And you can see in ward, I have to take yoga nidra of all the patients or shavasana, deep shavasana of all the patients, because only AVN patients, if I will take, other patients will disturb. So I used to take deep shavasana or yoga nidra of whole ward, and it helped them to fight with their psychological problems. Then moving towards observation and results. So you can see we have taken some goniometer readings, measurements, and some subjective, objective parameters. As I told, if we have to present our work, we have to present our genuine work, we need evidence on modern parameters in front of these conventional physicians. So we have utilized different scales: face pain scale, visual analog scale, then HOMAC, Western, Ontario, and McMaster University Osteoarthritis Index, depression, anxiety, stress scale, that scale, then whose hip disability and osteoarthritis outcome score, then Harris hip score. So that we will also come to know what are the changes before and after our treatment, and patient will also come to know what are the changes. So I will not go or dive deep in this because it will be time consuming. I just wanted to tell that we have to utilize this subjective and objective parameters and criteria to put forth our work in front of these conventional physicians and to convince the patients also for further treatment. These are face pain scales, visual analog scales, HOMAC score. All of these hip joint stiffness and pain. These are the questionnaires and basic questions, daily routine activities questions, and markings will be there, like walking, putting socks, getting on and off toilet, like that. Then depression, anxiety scale, as I told that the patients were landed in that, and it is also having questionnaire, how they feel, how they feel about themselves, about disease, about their sleep, and mild, moderate, severe depression, anxiety, stress scale is there. Then whose score? It's a hip pathology or hip pain and hip joint mobility. These are the again questionnaires and with angles. Then Harris hip score. Pain, limping, support, sitting, stairs, climbing, range of motions that we have to calculate with the goniometer, flexion, abduction, adduction, all the movement, range of movements at the hip joint. And you can see, I will not go in detail, just you can see the remarks before and after. It's improved, significantly improvement was there in case 1, case 2, then case 3, case 4, case 5, all we can see the significant improvement in this case before and after treatment. Case 6. Then moving towards the discussion part. Considering all the above histories and clinical presentations and radiological findings, treatment protocol designed on the principle of Asthi Dhatu Kshaya, Vata Rakta, and Asthi Dhatu Kshaya. In a modern aspect, avascular necrosis happens due to a permanent loss of blood supply to a particular part. But in Ayurveda, we can correlate it with Asthi Dhatu Vata or Vata Rakta. In Asthi Dhatu Vata is mainly degenerative disease. And for this Vata, Asthi, Majja and Sandhi, these are the main considerable factors on which our treatment was based to improve them. Hence the drug having Vata, Rakta Shodhaka, Rakta Prasadaka, Asthi, Majja, Vardhaka properties are used. And we have kept the holistic integrated approach of treatment protocol, which included Snehana, Svedana, Shodhana, in Shodhana Virechana, Basti, Jalokacharana, in Shamana oral medications, other treatment like Suchiveda, Agnikarma, acupressure, and in Brahana Chikisa, Panchakarma Kshira Basti, Mahasneha Basti, Mustadi Rajapan Basti. Then in Virechana, we have given Virechan for the better absorption of the Basti Dravya. In Basti protocol, शोधन, ग्रहण हे आपण स्टेप बाय स्टेप बसती we have utilized. Flourishing the Asthi Majja, Manjistatic Kshara Basti, Gomutri is there, and some other Rakta Shodhaka Prasadaka contents like Manjista Guruchi is there. Kshara Basti, alkaline enema, it's a fast spreading Sukshma Srotogami, which clears the Srota Avrodha. It is used in the condition of Srotorodha and vitiated doshas, particularly Vata and Rakta. Then Panchatikta Kshira Basti. After Shodhana Rupi Manjasta Kshara, then we have given Panchatikta Kshira Basti. As we know, Asti Srotodushti Chikissa, Tikta Kshira Sarpi Basti is mentioned, which gives nutrition to Asthi Dhatu. Then Mustadi Rajapan Basti, it's a Balya and Rasayana, tissue regeneration. Then Majja Basti or Mahasneha Basti, Sarada Sarava Bhavanam, Samanyam Vritikaranam. So we have utilized that, and for Jalokacharna has been done for promotion of the oxygenated blood to the affected joint. Then Suchiveda, which removes the obstruction of blood and establishes the normal circulation and removes and alleviates the pain also. Then Agni Karma and Shula, oral medication, exercise, Patya, physiotherapy, and all other modalities. Then, in those whole treatment protocol, some patients had rapid recovery in their clinical symptoms, and some taken time due to comorbidities like rheumatoid arthritis, hyperlipidemia, like that. And in hyperlipidemia cases, high cholesterol and triglyceride levels contributes to the atherosclerosis, plaques, obstruction in that vasculature or arteries, which narrow or blocks the blood vessels and reduces the blood flow. So we have given the tablet Avana in that cases. So according to Ayurveda, how the prognosis is there depends upon the stages and severity of the disease. Grade 1 and early stage of grade 2, it's a sadhya with the Ayurvedic therapies. And then late stage of grade 2 and early stage of grade 3, it's a crutch sadhya. Because some structural damage of bone starts getting involved. Ayurvedic treatment can help in symptoms management, slowing the progression. So it's a Cultural sadhya to Yakke. Then late stage of grade 3 and grade 4, which is asadhya and incurable. As per my experiences, some stalwarts or some practitioners may share their experiences about this, and they are most welcome after our presentation. Then we can see all patients had a satisfactory relief in their complaints, but the radiological changes not seen early. It takes time, more than 1 hour, 1.5 years or 2 years. So results drawn from the clinical changes seen in the patients before and after treatment by using different scales. So what I mean to say, that radiological changes, structural changes are not found there because it will take time. But still we can see in case 1, stage 2 and 3 was there, but it converted to stage 2. And in case 2, mild hip joint effusion was there, which was relieved. In case 3, bilateral AVN was grade 3, so it converted to grade 2. And mild bilateral hip joint effusion was there, that was also cleared. But in case 4, 5 and 6, they were not ready to go for the MRI. They were reluctant, but they are also clinically improved as we have seen in that scales. So now moving towards the last part, conclusion part. So the whole treatment was a holistic and integrated approach. And along with conventional medicines also as Gardinal and Ecosprin, what we can't avoid it, and we have, it's a gold standard treatment, we have to carry on it or continue it. It included Ayurvedic Panchakarma like Rukshana, like Dhara, Shodhana, then followed by Brahmana therapies, then acupressure, yoga, physiotherapy, because patient's relief was the main motto of our treatment. To create a basic line of treatment is a challenging in Ayurveda, as different Prakriti patients require distinctive treatments, or as per Prakriti, the treatment is varies. Then, so line of treatment is slightly changed in every case, like adding tablet Gardinal, Abana, Jaloka, in some cases avoiding Jalokacharna because they got allergic reactions to Jalokacharna. Then Virechana and Basti in few cases was according to Yukti Pramana. So it was according to Yukti Pramana. Then including yoga, that is Shavasana and Yoga Nidra, gave a mental relief to patients as patients were depressed as their daily activities were hampered. They are not able to wear their clothes by their own. They are not able to take bath by their own. And just what I discussed before in case present during the case details. So due to coagulative vasculopathy, due to post-COVID complications, this AVN may occurs, bone death may occurs. And other interesting thing what we found that maximum patients having dearranged their lipid levels. And due to this atherosclerosis also, this blood supply is hampered leading to AVN. Then moving towards the next slide. In use of multimedia or I want to know what the AVN patient feels and what they take the treatment all over the world. So I joined the Facebook group of Avascular Necrosis non-operative treatment group, and I found one WhatsApp Avascular Necrosis help group to help my patient, to guide my patients. Then, as I told, I visited and discussed with many of the modern conventional physicians and physiotherapists, and I visited their setups and I saw the grade 1 and grade 2 patients, they reverted like anything with the help of this matrix and magnetotherapy, but they are more costly, more than 1 lakh, and that to 3-month setting should be required. Slides are visible, Dr. Usha? Hello?
Yes, doctor, it is visible.
Okay. So it's leading to more cost. So patients were not ready to go for the these treatments. And then I visited to Hubli with some patients only. I came to know that Dr. Bhargav is treating with autohemotherapy with herbomineral injection. Means blood has been withdrawn from cubital fossa and then some herbomineral injection is mixed and it has been injected to the hip joint. So few patients went there and they took treatment for the duration what he has advised. Then we went to orthopedicians. With the help of orthopedicians, we are also given this hip joint injection to few patients with few duration also. And to avoid any complications, because something goes wrong, the whole hip joint may get arthritis, and then there is no any other option than surgery. So we have done the UHG guided intrahepatic injections also, intracapsular injections also. But the result was not so much fruitful, so the patient again reverted towards the Ayurveda and Panchakarma treatment. Then few patients went. I was very curious about what there is, what the different modalities or different options are there in AVN, in conventional or any other sciences. So in Hindu hospital they give the biphosphonated injection IV, but it is having their own side effects also. So few patients also took this biphosphonated injection in Hindu hospital also. So what is the future scope protocol? What we found during our journey with these AVN patients, I would like to say it's a journey, because I still think I am the student of Ayurveda and I have to learn, I have to get the new information, I have to get update, and it will definitely help my patients to get cured. So future scope protocols are Deepana, Pachana, and Deepan Pachana itself it comes under the Rukyan Chikitsa also, then Snehana, Bahyabhyantara, then Svedana, Ruksha Sweda or Snigdha Sweda, then Virechana as a Srotorodha, then Basti, both Bastis, Shodhana Basti and Bruhan Basti, then Jalokaucharna, Thanik Dhara, which comes under Rukshana like Dhanyamla Dhara, or Bruhana like Murivella Dhara or Pichu, then Suchi Veda, acupressure, physiotherapy, Yoga Nidra, Deep Shavasana. So psychosomatic approach should be there. Then just I told, grade 1 and grade 2 reversal I have seen, but the problem is the patient will come when the patient land up in grade 3 or grade 4. That is the negative thing of that. And radiological changes versus clinical changes, as I told or discussed earlier, that after 1.5 year or 2 year we can see the minimum radiological changes, but clinical changes we can see after one course of our Panchakarma course only. So we had welcomed all type of treatments which would be effective for patients. Treatment given to patients were non-invasive procedures, safe, highly efficient and cost effective. The Ayurvedic protocol showed more symptomatic results which helped to improve the range of movements of hip joints and psychological parameters, as well as radiological changes from grade 3 to grade 2 reversal with reduction in effusion of hip joint in few patients. For further strong conclusion, as usual, it's large sample size required, as if this is the case series, not case report. I have dealt with the 6 cases, but still larger sample size will be required to build up the Ayurveda treatment protocol for avascular necrosis of head of the femur and progress of the disease with integrated approach. In severe grades of AVN, irreversible osteonecrotic changes can be given as an action particularly. There is no as a yapya chikitsa till the patient take decision or get financial readiness to operative, we can treat them. Then Basti chikitsa and external therapies like Abhyanga, Svedana can be effectively used for post-surgical rehabilitations. And then documentation in the form of case reports, case series, what now I am presenting with modern parameters and validation of Panchakarma therapy should be done for the clinical evidence. Then more rigorous clinical trials should be done for the standardization of protocols, and educational initiatives should be taken for the expansion of research and education. So these are the students' feedback. I first presented this AVN journey in my college, and you can see how enthusiastically they have replied. They saw the patients who were crawling, who were on wheelchair, and they started from jogging, walking, running. That was their feedbacks, and this is my other student final year. We can see this feedback, and then we will move towards the patient's feedback.
Hello, it's Lavanya from final year, Bachelor of Ayurveda Medicine Surgery from Government Ayurvedic College Hospital, Dharashi, Maharashtra. So, on the month of March, there was a seminar on the avascular necrosis of the femur head, and it was well conducted by our HOD in charge of Department of Panchakarma, Dr. Sachin and the entire team. So, on that behalf, I want to give a positive feedback on the very wonderful presentation that was given by the entire team. As a part of the team, I have also researched about a patient named Mrs. Anuradha. So she was also having a grade 3 bilateral AVN on both the sides, and on the investigation and entire Ayurvedic management with the part of autoimmunotherapy also, entire treatment protocol was being given in a hospital, and there was a lot of positive change. The VAS score was also analyzed, and she was getting a lot of relief. Not only her, but entire 6 patients. The complete analysis of 6 patients were given in the presentation, and entire management was shown as a part of Ayurvedic, also and a part of physiotherapy also. So it was very positive to see the patients walking on themselves, running, and the expressions of their face was just tremendous. So thank you once again, and I want to congratulate entire team of Panchakarma department, sir, and the entire team which made this wonderful success and made our college a very good example for treating the AVN patients as the part of Ayurvedic management. Thank you so much.
So if we treat how the students will get the inspiration and the chain or the expansion of research continues in Ayurveda, to show that example, I have kept the students' feedback. Then we will move towards the result of AVN patients before and after. So this is video shoot in our IPD, Panchakarma IPD. You can see the limping gait and painful walking of the AVN patient before the treatment. And now you can see this video after discharge at home. See, the limping has been reduced, not totally reduced, but totally cured, but it's reduced. And still we told her to use the walker, because if he will put more weight on hip joint, again it will be Vata, or again it will be friction. So she has to put her weight on the walker. Then she is telling her feedback in Marathi. I will just tell the conclusion. What she is telling. She came crawling. She was crawling like animal by putting her both hands and legs, and now you can see she is walking. So we'll move towards next. Then you can see this AVN video before. And you can see both the videos. The same patient who is running, who was not able to walk properly, now he is running after the treatment. In previous he was limping. So this result can be given with the Ayurvedic treatments with Srodha and Shamana Chikitsa. This is another audiovisual evidence. And now you can see after the treatment how speedily now he is walking, and his limping and painful walking is relieved with some percent. So this result we can give with the Ayurvedic treatment. These are all our PGs and other hospital staff. He is a driver by profession, and he was not able to drive, and now he is driving his own vehicle because his bread and butter is on that vehicle only. He is telling this all in Marathi. I will show how he will walk. Now he is walking and he is driving. And now you can see how a patient can jog and run after the treatment, AVN patient. You can see this is after video. Unfortunately, I don't have the previous videos of both these patients. The patient is jogging and running. So, one thing I want to tell, that it was not technically possible for me to mask their faces, but I have taken their consents for this audiovisual publication for the education purpose. These are the even patients' feedback which is sent on WhatsApp and handwritten in our feedback book in hospital. Here in first, this one, to his clothes, he was not able to climb or he was not able to take bath. But now he can do this and he can tell, he is telling he is having 40 to 50% relief. These are the clinical evidences or written evidences, feedbacks, which will give value to our work. This again feedback. Then what are the research articles which we searched? And these are the different research articles from different journals. You can search it on Google. So I will not go through the details. And the all credit goes to our Panchakarma department team, right from the class 4 staff, brothers and sisters, interns, PGs, Panchakarma technician, Panchakarma Vaidyas, and mainly masseurs, because we write and they perform all procedures. So this is a teamwork. This is not a single-handed work. I thank all this my Panchakarma team and my colleagues who helped me, who inspired me, who given their feedback step by step, and my college dean and all other staff who helped me, encouraged me, gave suggestions, sometimes guided me to go through this AVN journey of my life and with my patients. So thank you one and all. And I want to add a point here. I know the slides are more and detailed, but the reason I presented this way is to encourage you all to keep records of the treatments that give and also prove the conventional science doctors that Ayurveda is effective and can treat patients where they have the limitations. So we have to keep this data, and this will lead for the further research also. And now the session is open for question and answers, and also for I'm eagerly waiting for the additions or listening the experiences of the same cases in their OPDs and IPDs. So it's open for all, and I'm really thankful once again to the organizers for providing me this platform to put forth my AVN journey or AVN work. So thank you again, Ayur Central, Ayurveda 1 and Dr. Usha. So now I hand over to Dr. Usha for further question answers and additions and opinions and their experience session. Thank you one and all. Dr. Usha.
Okay. Thank you, Dr. Sachin. Participants, now the session is open for question and answers. So if you have any questions, you may please either unmute yourself and ask the question. Dr. Sachin, you may please stop sharing your screen. You might just remain on video availability. You can stop sharing the screen. You can continue to be on the video.
Okay.
Well, looks like we have a question by Ujjwala Shilar. Sir, RA patient long-term use of steroid landed into AVN. So I think she is trying to ask if a patient with RA is on a long-term usage of steroid, will they ever land in AVN?
Definitely. The same thing happened out of 6 patients. All 6 patients received the vaccination, but few patients also received remdesivir and corticosteroids. And RA patients also received the corticosteroids like deflazacort and all other methotrexate and all other drugs. And this deflazacort and other type of steroids, they may land up into the AVN of the any joint or in particularly hip joint also. So this that one of the patient was RA only, and she also received the steroids for a few months. So yeah, definitely this may be the reason.
Okay, we also have a question by Anjali Krishnani. So she asks, is there any relation given in Samhita about using of Alabu cupping therapy in AVN?
Uh, as I told, there is no direct description about the AVN, but we have to compare the disease with Asthi Majjagata Vata, Asthi Majja Kshaya and Vata Rakta. And as we think of Vata and Rakta and Rakta Mokshana, then we can think of using the cupping or alabo. And what we use cupping is the modified version of the alabo only.
Okay. We have another question by Sindhana Udayam. Is autohemotherapy and herbomineral therapy help in non-regression of AVN, sir?
Autohemotherapy and herbomineral therapy, in few cases, what I told, in few cases they got relief, and in few cases they didn't get relief. So it varies depending upon the avastha, grading, and the patient's regular follow-up and patient's belief. As we know, placebo effect also. So it depends upon all these criteria. But what I felt in my cases, about these 6 cases, they didn't get much relief, so they again reverted back towards the Ayurveda and Panchakarma treatment only.
Okay. We have another question by Anjali Krishnan again. Relation of Rakta Mokshana in Asthi Majjagata Vata is not given.
Yeah, as I told, it's a good question. As I told, we are comparing AVN as a syndrome of Ayurvedic diseases like Asthi Majjagata Vata, Asthi Majja Kshaya and Vata Rakta. So, and main thing is that due to Vata Avrodha in Siraj, Rakta Avrodha is there and improper blood supply to the AVN joint is there, and to relieve that we have utilized Jaloka Charan, as Jaloka is having Hirudin, and which will break their obstruction. So in this angle we have utilized the Jaloka Charan or Rakta Mokshana.
Okay. Looks like we do not have any more question. Participants, do we not have any more question? In which case we will come to a conclusion of the session.
I again request all the participants, if they have also treated the AVN patients, they are ready to, they are open. If the session is open, they can share their views, their experiences regarding treating or viewing or any particular observations about the AVN treatment, Ayurvedic treatment.
Hello, ma'am.
I guess there are no more questions, and you have a.
Ma'am, can I ask one question?
Yes, Sujana, please go ahead.
Sir, you have told in RA Amrutadi Kukur, one of like in session. So how it acts in right RA you have told, means how to interpret RA in our Ayurveda.
So here the patient was having AVN along with RA and along with the history of post-COVID, and steroids of COVID and RA utilized that land up in the AVN, and also RA is autoimmune disease, and that also landed up in the AVN. And why Amrita Gugul is used? Because Amrita is again Rakta Prasadak, and here I have to treat the AVN along with Amavata. And that's the reason that particular drug has been utilized in that particular case, Amrita Gugul. Amrita mainly having Gulvel, Guduchi.
Okay, we have another question by Sindhana Udayam, who asked, can AVN be correlated with Uru Stamba?
It can be correlated with Uru Stamba, but the other symptoms they doesn't match much more, and so I have not utilized the reference, because with these 3 diseases and their line of it, I got the result, the fruitful result or positive result in the AVN patients. So I have not utilized that, but I will definitely think of it. And but if you are getting results with this line of treatments, I don't think that we should think of other diseases also. Yeah, but in Gurustamba, Plavana Chikitsa is told. So to reduce the as in AVN, mobility of hip joint is reduced. So aquatic exercises proven more helpful to reduce the this stiffness and increase the mobility of hip joint. So in that view, we can also think of Urustambas.
Okay, participants, like assuming we come to the end of the session, we will conclude the session now. Before concluding the session, I would like to mention that all the participants who were not able to join the session from the initial stage, I am putting out the WhatsApp channel link in the chat box. Okay, so kindly join the WhatsApp channel. So in couple of days, we will be posting the YouTube link of the complete session. So you can have a revisit of the presentation through our YouTube channel. So just in case if you are not able to join the channel through this link, you will also you will receive another link through while you receive the certification. So then you can actually join our WhatsApp channel. So you will get not only this session's recording, but yes, you will get all updates regarding our upcoming webinars, because we are committed to come up with one webinar every month to help our practitioners to be more confident in their practices and treat wide range of diseases. Okay, and I really want to thank Dr. Sachin TIke for presenting this presentation, because unfortunately he fell sick yesterday and he was not in a good state of health today, despite which he did not cancel the session and he decided to go on with the presentation. And I guess that was more seen in his speech. He was going through pain, severe abdominal pain, but despite which you decided to do it, and extremely thankful for conducting the session. The session was truly insightful and thought-provoking. The way you presented those success stories was both inspiring and reassuring, reminding us once again of the immense potential that Ayurveda holds in managing complex conditions by AVN. I'd also like to thank all our participants for joining us today, for your active engagement and for being a part of our growing Ayurvedic community. The curiosity and enthusiasm are what makes this session so meaningful. A big thank you to our sponsors, Ayur Central and Ayurveda One, for making this event possible. So, before we close, I request you all to check your chat boxes and join our WhatsApp channel. So, thank you once again, Doctor, for your valuable time and insights, and to all the attendees for being here with us. Until next time, stay connected, stay inspired, and keep spreading Ayurveda.
Thank you, one and all.
Thank you.
So, shall I leave now, Dr. Usha?